Hello everyone, my name is Oshingwa Esther Olafalakemi, and I'm going to be discussing the types of urinary catheters and how they are used to measure urinary output. First of all, a urinary catheter is a hollow partial flexible tube that is used to collect urine from the bladder, and it leads into a drainage bag. The urinary catheter comes in different sizes and types, and they can be made of rubber, silicone or plastic. The catheters are usually and generally necessary when someone can't empty their bladder. A urinary catheter can be used when one can't control when they urinate or have urinary incontinence, which is involuntary passage of urine, or they have urinary retention. The three main types of urinary catheter include the indwelling catheters, the external catheters, or also known as condom catheters, and the short-term catheters, also known as the intermittent catheter. The indwelling catheter is a catheter that resides in the bladder and can also be known as the Foley catheter. The Foley catheter is a type of short. The Foley catheter can be used for a short and for a long period of time. A nurse usually inserts an indwelling catheter into the bladder through the ureter. Sometimes it can be provided into the bladder through a tiny hole in the abdomen. The external catheter, or also known as the condom catheter. A condom catheter is placed outside of the body, and it is usually used for men who don't have urinary retention problems but have serious and functional or mental disabilities such as dementia. And this device usually looks like a condom that covers the penis head and has a tube which leads into a bag in which the urine will be passed out and flows directly into the bag. The condom catheter has a leg tube which it is attached to the legs for easy disposal of the urine in the bag. The short-term catheter, or also known as the intermittent catheter, is used for a short period of time after surgery, and it's used only until the bladder empties, and after the bladder is emptied, it is necessary to take out this catheter. Some catheters have a single bag which all urine drains into, while others have a separate chamber that urine drains into first. To measure the patient's urine output, it's important to note the time the patient's catheter bag was last emptied, and then you inspect the catheter bag at eye level and note the volume of the urine present. It is usually measured in milliliters. Record the volume of urine of the relevant output chart and the time of the measurement. Then you calculate the rate of the urine output. If the catheter bag is full, then they should be emptied after recording. In case there is a mistake and you need to record again, so don't empty immediately. Make sure you have fully recorded everything before emptying the catheter bag. And if the patient has a separate urine collection device, the valve should be opened and to allow the chamber to release the urine and empty into the catheter bag. After this, the valve should be closed, and then a fresh catheter bag should be installed, or the same one can be left. Thank you.